Hi, I'm Dr. Rebecca Hunton, founder of RHMD, where we help you become radiantly healthy. Today I want to talk about one of the unique features we have here at RHMD. We look at advanced lipid profiling and other testing to actually accurately predict your coronary heart disease risk, cardiovascular disease risk. In today's world, most physicians, most offices are drawing just the traditional cholesterol panel. And last spring, I was actually at a conference where one of the epidemiologists from the National Institute of Health said there are no biomarkers of aging in that panel. A biomarker of aging predicts whether or not you'll be alive in 10 years, need a nursing home or other assistance, or have cognitive decline. What a shocker. I mean, we've been programmed for the last few decades that the cholesterol panel is all that matters. It turns out that there's a lot of other particles that we need to look at and other factors to really know whether or not you're at risk of heart disease. We still care about that even though it's not a biomarker of aging because it is the #1 cause of death in women. It's one of the #1 causes of death in men, and all of us want to be here. So we use advanced lipid profiling that looks at things such as the Lp(a). Now, Lp(a) is a tiny little cholesterol particle that when you genetically make that, you are at very high risk of cardiovascular disease. It's not reflected at all in the traditional cholesterol panel. I'm sure you, like me, know that person who had that heart attack and stroke, and everybody walked around and said, but their cholesterol was only 165. Chances are they had that Lp(a). What about those of you who already know that your cholesterol is a little high, but you don't really want to take those drugs, or those drugs make you feel really bad? I'm talking about the statins. Do you know there's tests that we can do to show whether or not you're creating plaque and actually quantify how much plaque you have? So if I've done that test and I don't see any plaque, I really don't worry about the fact that you have a cholesterol of 250, and you shouldn't either. On the other hand, if we do those tests and we find a lot of plaque, then there's things that we need to do. As an integrative practice, we bring together both the right hand and the left hand, meaning if I need to, we'll write the prescriptions. But we'll also talk with you about how you should use your forks and your feet a little differently, meaning what you eat and what you do, to help minimize your risk. There are also natural supplements, like our omega-3s, that have proven benefits in cardiovascular disease. So for those of you who are over the age of 40, you really should have advanced lipid profiling done and to assess your risk of cardiovascular disease. We here at RHMD are willing to help you out with that, and that's one of the favorite things I have that I do. So thank you for listening, and have a radiantly healthy 2016.